Hello. Yeah. So good afternoon, everyone. So at the onset, I would like to thank Dr. Hunawar sir for giving me this opportunity to present in his IC. So I would be sharing some tips and pearls to get the best out of your residency. So now, when we join into ophthalmology, our primary aim should be that at the end of 3 years, we should be a very good pan-ophthalmologist. Ideally, we should know everything about everything, but in a practical sense, we should know something about everything. There's a lot of variety of questions and from different topics would be coming into your exam paper. So you should not leave any answer blank. So you should write something or the other into some of the answer. And always try to ace the residency exam. Just aim for a gold medal and try to do your best. And those 3 years will give you a time to chart your career course. See which subspecialty you are loving it. So you can plan your publications and everything accordingly and plan your further fellowships or SRships accordingly. Now the real world importance of residency, it is not just about passing the exams. There are a lot more things what you can do in the 3 years to become more productive, which I'll be telling in my subsequent talk. Now there are a lot of challenges in ophthalmology residency. The first and primary thing is we have a very less exposure at an undergraduate level. We hardly get 2 to 4 weeks of posting into ophthalmology, and that also we see very limited number of patients. And what we see are basically pterygiums and cataracts. We hardly get to go inside the operation theatre. So we are very new to all these instruments and gadgets and everything when we enter into the ophthalmology residency. We may not know what a slit lamp is. We may not know what a tonometry is, what a gonioscopy is. Forget about OCTs and fluorescein angiographies and everything. The first day you enter the theatre, the surgery may seem very intimidating to you. Because the seniors will tell that, oh, this is a hard cataract, you should not start with a hard cataract. You should not get a rent. The professor may get angry or something like that. So there are a lot of challenges what we face. And there is a sheer vastness of each subspecialty. Like in undergraduation, what I thought is passing is a very small book. So there's not much to be learned in ophthalmology. It is only when you enter into the residency, then you know that each subspecialty has these big, thick books. So that is how much you need to learn and read about all these things. And the curriculum is non-uniform. So there are a lot of different things to be read about. So try to be enthusiastic from day one itself. Because each posting into each and every subspecialty is an opportunity to explore something new in each of these branches. Well begun is half done. Resist the temptation. There are a lot of temptations nowadays, including online things like Netflix or Amazon Prime or YouTubes and everything. So if you have a spare time, try to work out instead. Follow some kind of hobby or a passion instead of wasting your time. Of course, once in a while you can do all these things, but not daily is what I would recommend. Try to read a book, not only ophthalmology, but there are many other books, novels and all that you can read to rejuvenate. Daily, read something new every day. Whether you are attending a theatre or you are attending an OPD, just see any interesting case what you see and try to read about it. Discuss with your seniors, discuss with your professors. So they'll be more than happy and willing to share their knowledge with you guys. And don't restrict your readings. Try to read from a wide variety. You may be reading from 2 or 3 different books, say for a particular topic, like say cornea, and your friend may say, wo kyun pad raha hai? Usme zyada details diye. It may not be necessary for you to clear the exams, but no, it is not like that. Try to read as much as possible. You will get some different point from each textbook what you read if you have the time. And you are allowed to read wide variety of books, including Krashmer, Ryans, Rosenbaum, review articles. Read a lot of review articles. They are very important. And there are a lot of online resources which will be discussed later in the IC. And try to make notes. Read from different books and make notes. Because you at the end, during the exam time, you may not be able to go through all the books again. So keep your basic text the same, be it Kansky or be it Zia Chaudhary, that way. So make notes from the main textbooks and put it in your main final textbook so that you just have to brush up just before the examinations. Always prepare for a class. Coming blank for a class is a waste. So you should know, you would be knowing the topics, the entire monthly schedule of your classes. So start preparing for your lecture at least 1 week in advance. Ask your teacher, ask the speaker, whoever your colleague is, whoever your senior is going to present that case or who is going to present that topic as to which is the best source to read. Go and read, make your notes and come to the class with those notes. and see if there's any additional point that is being said by the speaker, and add those things to your array of notes and then put it in your primary textbook. And don't forget to ask questions. However stupid they may seem, if you feel your colleagues will laugh at you or your juniors may laugh at you, you may be a second or third year resident and you feel if I ask this question, my junior may be knowing I don't know. Don't think it that way. Ask any question. And rounds is also very important. Be always tuned into the variety of cases that you would be seeing, be it in the OPD or be it in the surgical ward. Read and come, that is the bottom line. You should know each and everything of that case, the differential diagnosis, the management pattern and everything. And whether you're correct or not, try to give more number of differential diagnoses. It is not about coming to a particular diagnosis when you are presenting a case. It is about ruling out the differentials. That is very important. So that is how your knowledge will increase. And find a mentor. That is very important. And correspond with them periodically. Discuss diagnostics and interesting cases with them. And if you are wrong in any discussion, go and read. And then again come back and discuss with your mentors again. Like, this is what I read. This is what is given. Nowadays, everyone has net onto our phones. So any interesting case, just Google it. You see different presentations of the same cases. Like if you see a case of a toxo in the OPD, see different presentations of toxo. It may not classically be a headlight in the fog appearance each and every time. So see, there may be 5 or different kinds of presentations of toxo. So see that, read that online, so that your knowledge will increase. And definitely discuss it with your teachers. Believe me, your teachers are more than willing to discuss with you if you take the initiative. And be very pakka in your OPD procedures. Time yourself. If you time yourself from the first year residency itself, so it will go a long way when you actually when you are actually appearing for your final practical exams. So follow a protocol in all the postings. Like a vision, retinoscopy, refraction should take you 3 to 4 minutes. Your anterior segment evaluation should take you a minute. Fundus examination by both slit lamp and indirect should take you a couple of minutes. AT gonio maybe 3 to 4 minutes. So the entire examination should be over in around 10 to 12 minutes flat. So make this a protocol from day one, so that you don't get confused when you actually get your final case in your practical examinations. And when you have time, like after hours, like once your postings and everything is over, practice diagnostic skills like applanation, gonioscopy, indirect, and retino. Do it on your friends. Do it on the patients who are admitted. We always used to do it on our friends that way. And learn all basic surgeries also. If you have a facility of a wet lab that is available in your hospital, make use of it. So that will give you the confidence the first time you are actually operating on a human eye. So the basic surgeries, what you should ideally know is a cataract, DCR, trab, squint, entropion, ectropion, and intravitreal injections. No one will expect you to know vitrectomy at the end of your post-graduation. If you know it, it is well and good. And try to purchase some of your instruments, because what a sister gives to a post-graduation is a worse set. The scissors may not be working, the forceps will tear the conjunctiva. So keep a basic cataract set of yourself, buy it. So it will really help you. And give the sisters a day prior to autoclave and keep. Keep a surgical logbook, which is very essential for a DNB resident, because they do check it during the final practical examination. It will give you this means you will get more used to drawings also. So when your final exams, when you have a fundus case, you will have to do a drawing. You should know the color coding and everything. Attend meetings and conferences is very important, because you will listen to very newer things, the topics which are actually not given in your textbooks, because textbook editions come once in 3 or 4 years, whereas ophthalmology changes by leaps and bounds in 6 months. There's so many newer things that is happening. So always try to attend conferences. Attend different PG training programs just before your final exams. So that will give you an overview update of the newer things that is happening. Try to take part in quizzes in all these things and build your resume, because that is very important when you apply for fellowships or SRships. And get your names in prints. Try to win awards for best papers, best posters, because the competition is really stiff for fellowships and SRship. And try appear for international exams, because that gives you a very good leverage against your contemporaries when you're competing with them for fellowships. And of course, just before the exams, chill. Keep calm and study like Granger. Okay, not like Harry Potter. and during exams do lot of drawings and flowcharts, because they are not going to read the text what you have written. They'll just see the flowcharts and the drawings, and at the end celebrate because you were focused, you were well prepared, and you did your best. And in case you do not do very well in your exams, don't worry, because there are loads of opportunities that are going to come in the future which will give you a opportunity to prove yourself at different levels. So at the end, I would like to say, do not put your life on hold. There's a never, just a minute, so last slide. So there's never a good time to start a family or to get married. There's never a good time, like I'll go to gym, this thing, or I want to learn guitar or something. If we have a passion, try to follow it also along with our residency. It is not about studying. And if you follow your passion, make all other things, rest of the things in your life, personal life, continuing with your studies also, because that will make you a happier person and a better doctor. I got married during my post-graduation. This is me celebrating with my consultants after I did my 100 case. I was very focused onto the pizza itself, not on the celebration part. That is a different thing. We did a lot of celebrations, a lot of birthday parties, theme parties, and everything. I did my ICO fellowship just immediately. I applied for my ICO fellowship while I was a postgraduate student. So immediately at the end of my PG, the next month, I went for an ICO fellowship. So you plan your residency. So that will really help you a long way in getting a better fellowship and in getting a better job also. Thank you.
Thank you, Jay. That was very nice. Any quick questions to him? There's a slide, change schedule. Akshay will be speaking on conferences which wants to attend.